A baby's first cry is a universal symbol of hope and new beginnings. Yet, for many newborns, this moment is marked by hidden health challenges quietly waiting to unfold. This is the story of the newborn unit at the University College Hospital, UGHE Ibadan, where a dedicated team works tirelessly to provide care for babies facing the health challenge known as acute kidney injury or AKI. This initiative is committed to protecting the fragile lives of our littlest ones. This is a story about children, who they are, what they face, and how we can change their future.
My name is Michael Alao. Acute kidney injury means that when the kidney fails to work within a very short time interval. And what are the markers of this acute kidney injury? One is that the kidney helps in clearing body waste. When the kidney fails to work, the waste products tend to accumulate and they can become very toxic to the body. Beyond that, the kidney also is responsible for maintaining fluid balance in the body. So when the kidney of this very small baby fails to work, the body is not able to maintain the fluid balance and they tend to accumulate this fluid. And we know that when fluids are accumulated in the body, they interfere with the body working mechanisms. In our settings, the causes of injury to the kidneys are relatively very common. One of those is when babies are born and they fail to cry. And that's what we refer to as asphyxia. When baby fails to cry at birth, blood supply to the kidneys is impaired. And consequence of this, the kidney becomes damaged. Beyond the perinatal complications that babies tend to present with, which is common in our setting, is also the high risk for infection. So when babies acquire infections, which is called neonatal sepsis, the kidney is also not spared.
We heard about his health status. I was sad, which is normal, but then I didn't want to lose hope.
Over 850 million people worldwide live with kidney disease, far more than those affected by cancer, diabetes, or HIV. Yet, the stakes are even higher when we look at the youngest among us, as kidney issues can begin at birth. For some babies, particularly those born too early or under duress, acute kidney injury or AKI can occur unexpectedly. Premature infants are born with fewer nephrons, the essential units responsible for filtering waste, making them increasingly vulnerable as they grow. As the Department of Pediatrics at UGH embarks on screening newborns, they embrace a proactive approach to infant health.
My name is Dr. Tongo. I want to talk about the fact that acute kidney injury occurs in newborn babies. Acute kidney injury is what people used to term acute renal failure. Many a times people think newborn babies do not have this acute kidney injury or kidney failure, but they are particularly prone to this condition. And when it occurs, it's either it increases their likelihood of death, or if they survive, it can lead to long-term problems with their kidneys. And some of the conditions that make newborn babies have acute kidney injury include asphyxia, that is when they fail to breathe or breathe continuously when they are born, or when they have infection, which we call sepsis, or premature babies that are born before 37 completed weeks of gestation, their kidneys are particularly prone to injury.
I am Dr. Olumoyiwa Folayo. I take care of children with varying degrees of congenital and acquired heart diseases. I'm talking about neonatal acute kidney injury. It's been found that many children who have congenital heart diseases or even acquired heart disease come down with very different complications that affects the kidneys as well. And that's talking about the cardiorenal syndrome. Simply means that diseases of the heart that affect the kidneys. And so this is also a major contributor to acute kidney injury in the neonatal period. And that's why, as cardiologists and doctors generally, we consider it important that of every child who has a congenital heart disease that is picked either by early neonatal diagnosis, we make it a point of duty to also screen them for acute kidney injuries.
I'm Debo Ademola, pediatric nephrologist at the University College Hospital, Ibadan. So to prevent kidney disease in children, and one of the areas we need to start from is good antenatal care. Good antenatal care to prevent low birth weight babies, to ensure that babies are good weight when they're born, and to prevent preterm delivery as much as possible. And then when we notice issues that are related to kidney disease in children, to quickly present at the hospital. And some of the things that you may see is that if a boy, for instance, who is male, has difficulty in passing urine, and the urine stream doesn't come in straight. Normally when a child passes urine, urine should come in straight like a curve and go far. If a boy is not able to achieve that, it's point out to kidney disease. If the mother had antenatal ultrasound when she was pregnant, and it was abnormalities were detected in the genitourinary system, in the kidneys, when the mom was pregnant, it may be a sign of kidney disease. And if you notice signs like swelling around the eyes, reduction in passing urine, swelling in other parts of the body, those may be pointers to kidney disease. Somebody should present in a hospital where the child can be evaluated and treatment can be started early.
The hope for a brighter tomorrow. It's time to act, time to invest, and time to ensure that every child receives not only a fighting chance, but also the flourishing life they deserve. In the heart of Ibadan, this journey is just beginning.